Hello guys, today I'm going to talk about my case report. So on the scene of accident, my paramedics arrive at the scene of accident. The safety of the surrounding is checked, is safety. Personal protective equipment is present and responsive for the patient is unconscious. The airway is not obstructed, not obstructed. Breathing, the patient has tachypnea and also the respiratory rate is 28. So for the circulation, cardiac pulse is checked. There is cardiac pulse but weak and the pulse rate is 130. Blood pressure is also measured, is 95/65, and also the oxygen concentration is also measured, is 90. So, upon arrival, the medical carried out first aid action. So for the first thing, on the head region, paramedics give conclusion that there is superficial abrasion of the frontal region, and paramedics have already applied a bandage and covered the wound on the head, and also applied a splint on the neck. And for the chest region, paramedics give out conclusion that there is preliminary diagnosis of open pneumothorax. So what they did is they do a 3-way bandage at the lung on the chest region. And on the abdominal region, paramedics give conclusion that there is acute abdomen. And on the upper extremity, paramedics give conclusion that there is superficial abrasion of the right arm. So what they did, they put a spiral bandage on the wound. And for the lower extremities, they found out that there is open fracture of the right calf with hemorrhagic bleeding. So what they did is they applied a tourniquet to stop the bleeding, and wound is covered with bandage and splint is applied on the right leg. So lastly, they give infusion therapy on the cubital access of the left arm with saline solution 1 liter for 10 minutes and also morphine together 5 mg per ml. So after that, after first action is done, they check the neurological examination. So patient pupillary retractions show symmetrical and normal size. Reaction of the light is present, but the GCS scale is 6, E1, V2 and M3, and lateralized weakness is symmetrical. So after that, they do the head-to-toe examination. So on the head, they found out that there is absence of the skull fracture. Patient unresponsive indicates that there may be concussion, and also on the neck, neck is generally not affected, but the splint is applied, as I say. On the chest, there is presence of pneumothorax on the 4th rib level on the right lung, and it's currently covered by 3-way valve. And also on the abdomen region, there is presence of bruise sign on the right upper conduct region, and this may be indicated by internal hemorrhages. For the pelvic region, there is nothing. For the upper extremity, there is superficial bleeding on the right arm, but bandage is done. And lower extremity, there is deformed right calf due to open fracture. So there is also bleeding, but it is stopped by tourniquet application, and also right calf is immobilized by the splint and bandage. And after that, when the ambulance arrived at the hospital, the patient vital signs are all improved, and the paramedic referred the patient to emergency department and told the doctor about the patient condition and what they did to the patient. So for subjective examination, doctor obtains information from the patient mother. Patient name is Keong, 21 years old, male, Malaysian, single, currently a student, lives in Talofa Adin with both of their parents. So the past life history is the patient past life history is all healthy. Patient have no allergies, no underlying condition, and the doctor then measures again the vital signs, and all vital signs are improved. Better blood pressure is also generally increased due to replenishment of the fluid. Then patient is asked whether did he take the vaccination. The doctor asked to the mother. Then the mother said that the patient is vaccinated for tetanus and is at 15 years old. So then we carry out general inspection. For general inspection, the Glasgow Coma scale is 8 this time at the moment, and passive posture of lying on the supine position for the patient. And everything is normal. So to further exclude possibility of spinal injuries, X-ray and CT scans are needed for the spine. And the emphasis is also put on the respiratory system, cardiovascular system, GIT, and also CNS and muscular system. So infusion therapy at this time is continued with the same rate and continuous to monitor the vital signs. After that, checking the respiratory system, there is bulging in the intercostal space of the right lung. Respiratory rate at the moment is 25. Muscle retraction during respiration, unequal or lag expansion of the right chest during respiration, and also there is nasal wing participation in respiration. For the palpation, we can see that there is 4th rib is movable. There is tenderness in the wound area, crepitation and edema is felt during palpation. Walker fermentus is decreased and also decreased elasticity of the chest. So for percussion, we can find out that there is high resonance sound is heard on the right lung from the 1st intercostal space until the 5th intercostal space. And for auscultation, there is no absence of breathing sound on the right lung. So in conclusion, respiratory system may be compromised, and paramedic gives a 3-way valve, but it's not enough to resolve the open pneumothorax. So for treatment plan, maybe chest tube intubation or some correction for pneumothorax is needed. Surgical treatment of the fracture is also needed. Screen tests like plain chest X-ray, blood gas coefficient, and even some sputum examination should be done. For cardiovascular system, we can find out that there is weakening of the apex beat, tachycardia, and also shifting contours of the heart. Then continuous monitoring of ECG, heart rate, and blood pressure is needed. Chest X-ray is also needed. Ultrasound and CT scan of the heart is recommended for further investigation for cardiac tamponade. So for lab tests, cardiac biomarker, and also such as troponin T, CPK should be tested to evaluate the risk of developing myocardial injuries. And for peripheral vascular system, upon examination, the open fracture of the right calf is affecting the tibialis anterior and posterior artery to be weak and even can't feel the pulsation of the artery. And so plain chest X-ray of the leg region is also needed, and full blood count test is also ordered to check for internal bleeding. For the GIT part, GIT is compromised, and abdominal X-ray and ultrasound will be needed for a true investigation to see if there is any trauma or internal organs damage. Then urogenital system, in conclusion, urogenital system is not compromised. And so for my preliminary diagnosis, I can give that there may be superficial bleeding on the right frontal region with abrasion wound around 5 cm, superficial abrasion of the right forearm, pneumothorax of the right chest, acute abdomen, hemorrhagic, open fracture of the right calf, and 2nd degree of blood loss. So for the lab diagnosis, what we can see is that patient has low hematocrit, low red blood cell, low platelet count, low sodium level. For the liver function test, total protein level, albumin, and total bilirubin is low. The ALT, AST, ALP is high. Then the pH level of the arterial blood is low, and partial pressure of oxygen is also low. So for the instrumental test, you can see that ECG, based on ECG, there is sinus tachycardia, 125 beat per meter. Then for plain chest X-ray there is 4th rib fracture, pneumothorax is indicated without hemothorax. And on the X-ray of the head, there is normal, no fractures. For the X-ray of the right leg, the fracture is present on the tibia and fibula with 2 bone fragments is found on the X-ray film. Then for the ultrasound, there is ultrasound of the abdominal cavity, there is hemoperitoneum on the right hypochondrial region. So for final diagnosis, we can give that there is superficial bleeding on the right frontal region with abrasion wound around 5 cm, superficial abrasion on the right forearm, pneumothorax on the right chest with open wound on the 4th rib of the right chest and also fracture of the 4th rib, and also hemoperitoneum caused by liver rupture found in the ultrasound, and open fracture of tibia and fibula with rupture of posterior and anterior tibia artery is found. Then for preoperative epicrisis, the date of operation is 7th of November 2023. Time of operation is 2 p.m. So the social data: patient name is Wong Yung Keong, age is 21 years old, marital status is single, occupation is student, date of admission is on that day at the same day. So the planned surgeries are ligation of hemorrhagic vessels in abdominal cavity, chest tube insertion, remove of bone fragments on the right calf, and applied internal fixation for the fractures and fractures of tibia and fibula. The urgency of the surgery is emergency. Indication is life-saving. Contraindication there is none. So the risk, their hemorrhagic risk is high, thromboembolism risk is high, infection risk is moderate. So the overall of the operation risk is high. Then the type of anesthesia we decide is general anesthesia with intubation. Then the preoperative drug we gave halotane as general anesthesia and also clindamycin as antibiotics. So for the preoperative checklist, we did preoperative checklist. We identified the band present on the patient hand. We identified the urine before medication, and then loose teeth, crown bridges, whether there is dentures removed, hearing aid removed, contact lens removed, is the preoperative skin preparation is done, jewelry removed, valuable secure stored, all this we have already checked. So the preoperative checklist is passed. Then now we went to surgical intervention. So on the 2 p.m., the patient shaving on the surgical side of the chest and abdomen is done on the patient. Preoperative epicrisis checklist is being done as I mentioned. Then patient is positioned in prone position and transferred into the operation theatre. Then on 2:30 p.m., inhalation general anesthesia is given. Then endotracheal intubation is insertion of Foley catheter at the same time. Red blood cell transfusion is given. Fresh frozen plasma is also given, and prepping, draping, and aseptic technique is done on the surgical side. So at 3 p.m., the surgery is started. So first incision in the right hypochondrial region, identifying the source of bleeding and access to the extent of hemopericardium. Then ligation of the rupture of blood vessel to control bleeding, remove blood clots and debris to clear the abdomen cavity. Then closure the incision by suturing the muscle and skin. Then this is on the abdomen region. Then simultaneously we have another surgeon doing on the chest region. So first, at the same time, incision of the chest between the midclavicular and anterior axillary line on the 4th to 5th intercostal space is done. Chest wound is sutured and covered by bandage. Chest tube is insertion on the right thoracic cavity. Reinfusion of the blood from the abdominal is also done at the same time. Then for the bone fragments, the bone fragments of the right calf is removed. Internal stabilization such as screw, platelets are used to stabilize to fix the fracture. Then posterior and anterior artery are sutured, and the wound of the right calf is closed by suturing. So after that, the patient is transferred back to the ICU ward after the surgery around at 10 p.m. at night. So not 10 p.m. 8 p.m. at night. So for the post-operative epicrisis, first at that day after surgery, 7th of November 2023, patient condition is checked regularly every 2 hours on the day after surgery. Urine catheter is continued. Medication is given, analgesic and prophylactic medicines such as clindamycin and morphine. Patient regained conscious at 9 p.m. Then doctor came in and checked for the condition. MPO is given for the patient. Superficial abrasion wound on the head and right forearm is checked and bandage are changed. Laboratory instrumental test is done again after the operation. RBC transfusion is done with 75 ml per hour. Chest X-ray is taken. So for the laboratory test, chest X-ray, everything has shown improvement, and chest X-ray, instrumental test, ultrasound is also indicate that everything is fixed. So for the next day, we can see that the patient is transferred to the normal ward as patient already gained conscious, and dressing of the surgical wound is checked and changed. Infusion therapy is continued with same rate, and medication also continue. So this is the second day, and now we pass to the third day. For the third day, what we can see is the dressing of the surgical wound of the superficial abrasion of the head and arm is also checked and changed. Normal saline solution therapy is continued, and medication is continued given. And for the fourth day, patient diet changed to soft diet, MPO is stopped. Morphine is stopped given as patient does not complain about pain anymore. Urine catheter is removed, and casting of the right calf is done. Then on 11th of November, infusion therapy is stopped. The bandage of superficial abrasion on the head and right forearm is removed as the wound is already recovered. Then on the 8th day after surgery, antibiotic medication is stopped. Chest tube is removed as spirometry test is normal and bandage is applied on the chest wound. The 4th rib is recovered by its own. The patient in patient care and appointments are made. The patient is in outpatient care and appointments are made for the next checkup. Medications such as analgesic and anti-inflammatory drug are prescribed for the patient to eat at home. Then on the 28th of November, on the 22nd day, doctor saw the X-ray result of the patient and decided to wait for 2 weeks for the bone to heal for the fracture of the tibia and fibula. Then on the 16th of December 2023, patient come again to visit the doctor, and this time the X-ray of the right calf is done. The bone indicates that it heals completely, so doctor decided to remove the cast. Yeah, and so that's all for my presentation. Thank you.